Hello, everyone. Hi there. It is so nice to see everyone over here. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician. And today we are doing these live session talking about inflammation. And today I want to also kind of let you know about how it is important if you have a thyroid disorder that you should definitely work on inflammation. So very important piece that we are going to talk about today. But before we get started, it is time for introductions. So please introduce yourself into the chat section. It will be very nice to know where you are joining us from. And today I realized that I never asked you guys, like, well, what is your main issue that you are dealing with? That's the reason that brings you over here. So please share that one or more, at least one symptom or problem that you are going through that brings you over here. Because that will be a very big aha moment for me to know, like, what problems and things that you guys are suffering from. Because that will be very, very for me to know you people, because you are my loyal people who have been with me for such a long time, and I want to create content or, like, solve your problems in the future videos too. And it's good to know, just kind of, know sharing is always important. So please share in the comment section what is going on with you that you need help for. If you can share a specific symptom, that will be useful, because thyroid inflammation and things, yes, a lot of people might be going through, but if there is one symptom that which is bothering you the most, or one thing which is bothering you the most that you want to improve about your health, and if you can share that, that I think will be very, very powerful for me, and then I think it will be powerful for you to recognize actually what is that one thing which is bothering you the most. Because I think most people don't even think about it. They just know that they have this problem, or they know that something is going on with them, but they have never given it a deeper thought. So please think about it. Share it in the chat section, so we know what you guys are going through. That will be very, very important for all of us to know. All right, so we have Priyanka from Delhi. Surbi is joining us, and then Benton Harbor, Michigan, has issues with bloating and inflammation. Absolutely, bloating is a very, very common problem. Adeline has an issues with sugar and thyroid, so absolutely another problem. Aisha has question with overactive thyroid, hyperthyroidism. Very, very interesting that I was not seeing overthyroid or hyperthyroid clients for a very, very long time. But I will say in the last 3 4 years, like I've started seeing more and more hyperthyroid clients. So I don't know if, like, maybe more people are being diagnosed with hyperthyroid very often. Sometimes Hashimoto's goes towards the hyperthyroid side of it also. So that is also happening. But yes, hyperthyroid definitely. Maninder again said that she's going through hyperthyroid. So yes, more and more people are going towards that. Deepak has showed that he's going through a lot of pain and depression. Again, very, very common issues. Again, underlying inflammation and thyroid both can do that. Dana is joining us from Texas. Welcome over here. Annalie has issues with high blood pressure and palpitations. Again, very, very common problems. Thyroid related skin problems. Yeah, skin is a big problem. A lot of people come to see me because they have either rashes or acne or random hives that they are not getting better from. So very, very important thing. Weight gain and tiredness, low energy. Yes, low energy is a big issue. Like, again, that's very interesting that like a lot of people that come to work with me, for my clients, they have this issue with a low energy, and they never tell me firsthand when I ask them what is the main issue. They never tell me that it is because of low energy. Once I start digging, and then when I realize and tell them, okay, well, looks like your main issue that you're not able to work through it is low energy, and they will say, yes, actually low energy, I need to take a nap. So yes, low energy is a very common problem. A lot of people don't realize it. So absolutely. So Aisha has blood sugar and overactive thyroid, type 2 diabetes, hypothyroidism, and then hidradenitis suppurativa. Yes, that is a very difficult disease to deal with. I totally agree with that. Um, Iris is dealing with PCOS, which is actually very interesting. That PCOS, everybody thinks is just female hormones. No, it is actually a metabolic disease. PCOS, most people don't realize it starts from insulin resistance. And then finally, it leads to hormonal imbalances, especially testosterone being elevated and then having estrogen as a problem. So, yes, very, very important thing that a lot of people don't even know. PCOS being metabolic disease, well, I thought it was hormonal. Well, yes, all of our hormones are interconnected. And again, all of the hormonal dysfunction starts from where? From inflammation, right? So that's the reason inflammation is the key. And that's what I want everybody to understand is that, why I'm focusing so much on inflammation is that literally all the diseases that you have mentioned, type 2 diabetes, hyperthyroidism, hypothyroidism, Hashimoto's disease, PCOS, skin problems, bloating, gut issues, all of these have root cause as inflammation. Even hidradenitis suppurativa, yes, that is because of inflammation too. So that's the problem with inflammation. It is affecting all over your body, and that's what is causing this problem. Menopause, TSH is very high. Yes, so lichen planus, definitely is a big issue, which is dealing with again an autoimmune condition. Constant fluctuations of blood pressures, absolutely. Pain in the feet and toes, which is very interesting. A lot of times, the pain in the feet and the toes can be for various reasons, but can be because of thyroid too. So yeah, looks like we have a lot of problems that people are going through at this point of time. So and as I said, a lot of these problems that you guys are dealing with has root cause somewhere inbuilt in inflammation, and that inflammation has different root causes. So finding the root cause is very, very important also. So what are your root causes or triggers of inflammation, which ultimately is destroying your body and leading to all of these diseases. So absolutely. Yeah, I mean, so thank you for sharing all of these things. So seems like you are at the right place to learn about inflammation, and I think a lot of people over here definitely have issues with thyroid. So that is definitely the topic today that we are going to share about thyroid and inflammation, why it is important to know about it, and what you can do to get better, right? Because the goal is to have actionable steps. That's my goal. Okay, so I'm going to do a very quick presentation. A lot of you might know in terms of what is going on with you and how to improve the thyroid. But I want to be very specific about inflammation, what you can do to reduce thyroid inflammation, so that will be very good for you to know. Okay. So let's get started. And then obviously we will go over questions also. But let's start with this presentation. Okay, so what's important over here is that so how to calm inflammation and thyroid. That's where the main important thing that we're talking about, right? Now, why you guys should be very much focused on, right? Inflammation. So that's the main thing, right? So it is just like Hashimoto's is a number one disease. Okay, if you have hypothyroidism, there is a 90% chance that it is because of Hashimoto's disease. Most of people don't even know about it. Why do you have hypothyroidism? They talk to the doctor, they said, well, it does happen. It happens. Well, no, it doesn't happen. It's your body doesn't decide one day to, have your disease, right? There has to be a reason. And the reason is Hashimoto's disease. So first thing, if you have never checked yourself for Hashimoto's disease, go and get that done tomorrow itself. Okay, simple test available world over, simple blood tests. Okay, so it's not complicated testing. You just need to check for two antibodies. One is TPO, thyroid peroxidase antibody, and the other one is thyroglobulin antibodies. If both of the antibodies or even one of those antibodies are high for you, that is diagnostic of Hashimoto's disease. Okay, so please, 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 if any of you have never checked you for Hashimoto's, go tomorrow and get it checked so you will know the reason of your thyroid disorders. Okay, and why that is important, because the reason is that then the inflammation matters more to you, because this inflammation triggers the antibody production that destroys the thyroid gland. Okay, and research studies, okay, there was this studies which was published in 2020 very recently, shows that chronic inflammation is the reason of antibodies, and the more inflammation present in your body, the higher the antibodies present in the body. Okay. And the higher the antibodies, the more symptoms you have, the more damage to the thyroid gland which is happening. So that's the reason it is important. Okay. I'm not just saying, okay, well, for research purpose, do work on inflammation. The reason I'm saying is that the antibodies are directly linked to your inflammation piece of it, and the higher the antibodies, the higher the inflammation levels in your system. Okay. Now you said, okay, well, I do have antibodies, what does that do with my symptoms? Well, that's where it is also shown that symptoms are also linked to inflammation. Okay. So again, another research study, as you know that I'm a research person, so everything that I want you to know about is based on research. So again, the research shows higher the antibodies, higher the symptoms. Okay. Now interestingly, like, we don't have significant research studies which shows that the worse your thyroid labs, the worse the thyroid symptoms are there. Okay. So very important, right? So yes, if your thyroid labs are abnormal, you can have symptoms. I'm not saying you should not have symptoms, but the worse the thyroid labs are, the worse should be the symptoms. We do not have credible research to support it, but we do have credible research to support that higher the antibodies, higher the symptoms. And you will see all of these symptoms are very common with thyroid disorders, right? Fatigue, hair thinning is a very big problem, brittle nails, weight gain, brain fog, constipation, bloating, mood changes, anxiety, depression. Like, if you have any or all of these symptoms, then definitely it is because of those antibodies, because your thyroid is not functioning, which is because of that inflammation piece of it. So very, very important. So if anything you learn from today's thing which I'm sharing with you is thus these two things, is first of all, you should know whether you have Hashimoto's or not. Okay. And inflammation is causing the antibodies to be present in your system. And the higher the antibodies, the higher the symptoms will be there in the body. Okay. So these are all correlated. Okay. So that's what you need to think about. And that's the reason, unless you address that inflammation, your antibodies are not going to better, you are not going to also feel good. Okay. Now this is just for geeky people like like me, who like to know the biochemistry and physiology, what is happening, how inflammation damages. Basically, it activates your immune system, which releases something called cytokines, which causes oxidative stress, which is a fancy name for inflammation, that again leads to destruction of the thyroid cells. Okay. The damaged thyroid cells leak thyroid proteins, the thyroglobulin, which again is actually triggering more immune attack, and that actually again activates your immune system to release more cytokines. So this keeps on going on as a circle that attacks and damages your thyroid gland. So it starts with chronic inflammation, and then like ends with kind of having those antibodies and damage to the thyroid gland. Okay, so that's what it is. Somebody has this question: can you repeat the Hashimoto's root cause? Yes, so root causes are coming over here. This is the next slide over here. So the root causes are very similar for Hashimoto's and inflammation, because obviously, the Hashimoto's is an inflammatory condition, right? So what are those? Food sensitivities, right? Gluten, dairy, soy is the most common food sensitivities. You might be sensitive to other foods. I'm just sharing the most common ones. Toxins, as you all know, heavy metals, pesticides, BPAs, which are present in plastics. Deficiencies of nutrients like selenium, zinc, omega-3, vitamin D, chronic infections, especially Epstein-Barr virus infection, gut dysbiosis, chronic stress, cortisol imbalance, adrenal dysfunction. All of these, are triggers which fuel this fire of thyroid damage. Okay. So unfortunately, your task is to work on all of them. Okay. People think, or most people that work with me, oh, well, I've already addressed my gut. I've already removed gluten, but I didn't see a difference. Well, unfortunately, you didn't work on your toxins. You didn't work on your chronic infections. You didn't work on rebalancing your adrenals, right? So it is just not one thing. You cannot pick, it's not a multiple choice question where you have to pick one right answer. You have to work on all of these root causes, all of these triggers. But then once you work on all these triggers, that you get good results that way. Okay. So these are the triggers that you need to start working on, thinking about working on. Okay. So that's the basically, right? What's a three-step solution, to help your thyroid inflammation? Reduce the immune triggers, right? The more, the less the triggers are there, the less inflammation is there. How to lower thyroid inflammation and how to repair the damaged thyroid tissue, right? Because that inflammation which you have detected today, it did not start just today. You just came to know about it today. It was going on for years. Okay. We, most people who have been diagnosed with a thyroid disorder, Hashimoto's, they have been going through this condition for 2 3 years before finally the labs will pick it up. Okay. So a lot of damage happens, and that's the reason, it is very important to know how long the damage has happened so you can fix it. So the step one, basically how to reduce the immune triggers, you remove these foods: gluten, dairy, soy, corn, sugar, alcohol, processed food, and meats, right? Yes, unfortunately, these are the foods that a lot of us will eat on the regular basis and is a part of our diet. But unfortunately, if you have inflammation, you have to give them up for at least a few months so that inflammation fire can die down. And then maybe you can try to reintroduce them back. Okay. But at this point of time, if you want to get them better, you need to remove these. Okay. Now, somebody has this question, well, how do you know whether we have chronic inflammation or not? Are there specific tests? So, yes, there are specific tests to check for inflammation. The three favorite tests of mine, one is HSCRP, the other one is ESR, and the third one is homocysteine. So these are the basic tests. Again, each and every lab can do them. That helps to detect inflammation. Okay. Again, these are not perfect tests. Okay. But yes, at least at this point of time, these are the best markers that can at least give you an idea whether you have inflammation or not. If they are high, that means you have inflammation. Okay, so step one, reduce the immune triggers. So basically, you remove all of these foods as best as you can. That will definitely help you in reducing your immune triggers. Okay, how to lower thyroid inflammation? Okay, remember this. Today we are talking about mainly specifically your thyroid inflammation. So one of the main nutrient you need is selenium. Okay, we have several research studies which shows that selenium can lower the thyroid inflammation and the TPO antibodies. Okay, I just quoted one research study over here, which shows that this can lower the TPO antibodies by 40%. So that's pretty significant actually, because if you go to your regular doctors and ask them, can you lower in your thyroid antibody levels, they will say no, that is not possible. But obviously majority of our patients will see lowering of their thyroid antibodies, so this is a possibility. Selenium works really good for that. Difficult to get through food sources, but best food source is Brazil nut. 2 to 3 Brazil nut actually a day will give you around 80 to 100 micrograms of selenium, which is kind of a good dosage. Sardines and eggs have some selenium, not a very good source, okay, but at least there are some selenium which is present in food. So that's the reason most of us are low in selenium. The reason being there is not much of a food source of selenium. That's where supplementation is very useful. So if you do have a thyroid disorder, especially Hashimoto's, even if you have hyperthyroidism like Graves' disease, we have research studies that selenium helps to lower antibodies in Graves' disease or hyperthyroidism too. So selenium should be a part of your regimen. Now the important part is that if you're taking a supplement, it has to be in the selenomethonium form only. The reason being, selenium alone cannot be taken because it will not be absorbed. So the selenium has to be attached with a molecule. In this case, it is a methionine form. So it is absorbed better from your gut. If it is not in that form, it doesn't get absorbed. So you're taking a supplement which is useless. Okay. So that's what you have to understand. Selenomethonium is a best form, and the dosage is between 100 to 200 micrograms. Okay, that's the minimum dosage that you need based on the research studies to help improve your selenium levels. Okay, so selenium, number one supplement if you have a thyroid disorder and you want to lower your inflammation levels and your antibodies. Selenium is definitely the most important mineral that you need to have. The second one is zinc. Now, most of the people think zinc is actually an mineral which helps in immunity, right? Because a lot of people take zinc lozenges and other things to help support a viral infection. But what they don't know is that zinc again plays a very significant role in thyroid inflammation and thyroid too. First of all, it supports the conversion of T4 to T3. Now, as you know, our thyroid gland produces two hormones, T4 and T3. Mainly T4 is made, which is an inactive thyroid hormone, and then it needs to be converted to T3, which is the active form. Now, a lot of this conversion is not happening in a lot of people. Okay. And now a lot of people are taking T3 hormone as a medicine. Well, yes, you can take it as a medicine, but sometimes you can just do natural things to improve the conversion. And one of those things is this zinc. So, a very great way. Zinc is also helps in lowering thyroid inflammation. And the research study shows that when you combine zinc and selenium, then you see much more lowering on inflammation in the thyroid, as well as much more thyroid antibodies that can be improved. Zinc, there are several sources of food sources, mainly seafood like oysters is good. Then beef is also good. And then vegetarian sources are pumpkin seeds, some lentils, legumes, those also have some zinc in them. So those are all good sources of zinc that you can do. Unfortunately, from the vegan or the vegetarian sources, the zinc is not readily absorbed. Okay, so it is absorbed less in your gut from the vegetarian sources. From the meat as well as the seafood sources, the zinc is absorbed better. Okay, that's where you can also do supplementation. Zinc bisglycinate or zinc glycinate is a better form. There are different forms, zinc oxide, zinc carbonate, and things, but zinc bisglycinate has the highest absorption from your gut. 30 milligrams is typically the dosage. Some people are taking very high doses of zinc. You do not want to do that because it lowers copper levels. So again, you need to know what is the right dosage. More is not always better because it can create problems. You might read a lot of on, like, news that, okay, well, this person got their kidney damage or liver damage or land up in the hospital because first of all they're taking wrong dosage of the supplements, and the second of all is that they are taking supplements with poor quality. Okay, because your supplements might have medicines added to it, or they might have just chemicals added to it which can damage your body. So very important to source your supplements properly and also do the right dosage. Okay, the other one is lower thyroid inflammation. The next thing over here is omega 3s. Again, we have great research studies, like which shows that omega 3 fatty acids, especially EPA and DHA, will lower CRP, right? Somebody had this question, how to check your chronic inflammation? And I said, HSCRP is a marker of inflammation. So now we have research studies which shows that omega 3 fatty acids can lower this inflammation levels, HSCRP. Okay. So definitely very important to include omega 3s in your diet as well as supplementations. So food sources, as you know, fatty fishes are the best food sources of omega 3s, which are salmon, sardines, and things. If you are vegan or vegetarian, you can do walnuts and chia seeds. Now, so that's the case. But what the research again, you might have heard of research studies which tell you that omega 3s are useless. They don't work. They did this research study on 100,000 people, gave them omega 3 supplementation. They did not see any improvement in their health parameters. The reason was they gave them very low dosage. Okay, only 2 to 300 milligrams of omega 3 a day. Well, the research shows us you have to have at least 1,000 to 2,000 milligrams of omega 3s. And there are several different omega 3s. Research is very clear. Only two types of omega 3s, EPA and DHA, are the only one which has shown in research studies to have health benefits. Okay. So, again, start knowing your supplements. Especially fish oil is one of those supplements available in the market, which is a supplement which will tell you almost wrong things. That means that supplement label is always misleading. Okay, it will say omega 3s 1000 milligrams or 2000 milligrams. Well, it doesn't even talk about EP and DHA. Okay, so, like, I don't know, it's not so much visible over here, but if you can see over here, you can see this label of the supplement that we have created, which has omega 3s, but then it tells you exactly EPA and DHA how much is present. Okay, so that's what the supplement you're looking at, which tells you exactly how much EPA and DHA, and then add those EPA and DHA, and it should come to at least minimum of 1000 milligrams, ideally between 1000 2000 milligrams. Okay, So this is Omega Max supplement that we have created. If you want to buy it, definitely you can go on our supplement link to buy it. But omega 3s are very important to lower inflammation in your thyroid gland. Okay. Then comes the next one is curcumin, right? So you might have heard about curcumin. It's basically turmeric, right? So turmeric is an Indian spice used in Ayurvedic medicine. The new research shows the compound that actually works in turmeric is curcumin, right? So curcumin can lower thyroid inflammation also. Okay. Again, I am backing it up with the research study which was published in 2018, which shows that curcumin lowers thyroid inflammation. Okay. So yes, you might know that it lowers inflammation otherwise also, but specifically in thyroid also, it lowers inflammation and basically inhibits the NF kappa B, right? Now the problem with curcumin is that it is poorly absorbed in your gut. Only 30% of curcumin that you take as food gets absorbed from your gut, and 1 teaspoon of turmeric, okay, might have only 2 to 3 200 to 300 milligrams of curcumin, and if only 30% of that is absorbed, then just imagine how much you are getting. Very less. So that's the reason you have to combine it with black pepper. You might have heard it, or you combine with other supplements like boswellia and quercetin to improves the absorption of it. Okay. So that's where we have created this inflammapro supplement, which combines the power of curcumin, boswellia, quercetin, ginger, all of those things. So that way the absorption of curcumin is increased dramatically, and it works on inflammation levels, all different levels. Okay. But yes, make sure you do include curcumin or turmeric in your diet as much as possible, but also as a supplement is what I will highly recommend, because you're using it for you like reducing it. So as you know, this inflammapro, one of the major supplement that I have created, which works really good, has so many different anti-inflammatory things into it. As I said, like turmeric, it has boswellia, it has ginger, it has quercetin, it has rutin, rosmarinic extract, resveratrol, all of these things, which works on different inflammatory pathways. So if one supplement that you should include is this inflammapro, because it works on reducing inflammation all over your body, including your thyroid. Okay. Then comes the step 3. Okay. So that was your step 2, stopping this whole inflammation cascade, right? So that's the main thing that we are dealing with, guys, of reducing or stopping the inflammation cascade. Okay. So very important that you do that. That step is very important. So first step is kind of removing the things which are damaging your thyroid. The second thing is reducing inflammation, and the third thing is supporting thyroid tissue repair. Out of this, vitamin D is very important, right? Now vitamin D is actually a hormone. Okay. It's a pro hormone. So if you will know new research studies, or if you google it up now, vitamin D is considered as a pro hormone, because literally it works from head to toe from your body. And specifically for thyroid, again, research study shows that it can lower the antibodies and support the thyroid health. Okay. So that's very good over here too. Again, vitamin D, as you know, there are not many good food sources, right? So that's where the supplementation is very useful. So you can definitely do that. So vitamin D combined with vitamin K2 works better. So if you are buying a vitamin D supplementation, buy it with vitamin D with K2. We have formulated this vitamin D supplement, which will be on our website, where you can buy the combination of vitamin D with K2. And dosage is very important. Don't do very low dosage, but don't go very high. Around 2000 to 5000 international units is a good dosage of vitamin D. Support thyroid tissue repair. Next thing is managing stress, right? Very important. Do meditations, deep breathing. Adaptogenic herbs like ashwagandha and rhodiola are very important. Apologize, there is a spelling mistake. It should be rhodiola. It is rhodiol right now. But yes, rhodiola is also an herb which is adaptogenic, and ashwagandha is another one. They are going to be helpful for managing stress for you. Good quality protein is very important, because again, that repairs the thyroid tissue. So if you are eat animal products, then chicken and fish is good. If you don't eat animal products, then try to include legumes, lentils, chickpeas, chia seeds, nuts and seeds. Those are all. So things to give you adequate protein, but adequate protein is very important, that supports your thyroid tissue repair. So these are the three things that you definitely need to include: vitamin D, managing stress, and protein, which is going to help you support the thyroid tissue repair system. Okay. So what is important? The thyroid healing plan, right? How do you implement this? Okay. So as I said, antibodies are not just the number. These are the basically the sign that your ongoing damage is there. Calming inflammation is very, very important. Okay. And this is where the right foods, right lifestyle plus targeted supplements will be very, very useful. Okay. As you guys know that I have created this specific thyroid supplement which has right form of zinc, it has right form of selenium, it has some adaptogenic herbs, either ashwagandha or rhodiola, which supports your thyroid tissue repair. It also has L-tyrosine, which is an amino acid which again gives the necessary ingredient to make more thyroid hormone and also repair thyroid tissue. Okay, so very important. A lot of people are taking zinc separately, selenium separately, iodine separately, L-tyrosine separately, while this thyroid balance has all of those things in them. So you don't have to kind of take multiple different supplements. Okay, so that's a way you have to include the a combination approach. Okay, so this is the advanced thyroid bundle, as you know. So it has everything: the thyroid balance to support and lower inflammation in the thyroid. Inflammapro will also lowers inflammation, omegas, and then plus magnesium and the probiotics, which is going to support your overall thyroid gland. Okay, so that's the plan that I wanted to share with you. Okay, of a thyroid healing plan that I wanted to share with you. Very, very important. So again, to summarize for you, there are three steps. First step is removing the triggers that are causing inflammation to your thyroid gland, which are those foods. Okay, gluten, dairy, soy, corn, alcohol, sugars. Second thing is reducing inflammation in your thyroid so you can lower the antibodies as quickly as possible, so that way your symptoms gets better plus your thyroid gets better. Okay, that's where selenium, zinc are top. Then after that comes the omega 3s, and then comes the curcumin and other anti-inflammatory compounds. Then the third comes is repairing the thyroid tissue. That's where you need to have good quality diet with high protein diet, good quality protein. Okay, then you have to do along with that vitamin D with K2, and then working on your stress. Okay, so if you do these three steps, which includes your diet as well as you involve all of these supplements, do them for at least 2-3 months, then you're going to see an amazing result, that your antibodies will start getting better. You will also feel that your energy is improving, overall vitality is improving. So all those things will you are going to see that. Okay, so try that, and then obviously share with me what improvements you have seen. And unfortunately, if you're that person who are not seeing an improvement, then there is some root cause that you have not yet addressed. Okay, which can be either toxins or chronic hidden infections. Those are the most common reasons people do not get better, because this protocol I've tried in thousands of people and it works. But when it is not working, then that has to be that hidden thing that has to be identified and then worked on it, and then your antibodies get better, and then obviously your body gets better. So try this out first. If that basic plan is not working, that's where you need to work with a functional medicine provider to kind of figuring out the root causes, and then working on them to get things better for you. Okay, so you can work with me also. As you know, you can email us back and inquire about working with us. We offer virtual consultations world over. So that way, wherever you are in the world, we can actually provide consultations to you. So just email us over there. So that was from what I wanted to share with you. Then now let's take on some questions. So please start posting your questions into the comment section, so I can kind of answer those for you. If you have any specific questions about any specific symptom, you can also mention that. I will try to answer as best as we can. But yes, start posting your questions so that way I can also start answering them for you. Okay. Okay, so let's see. Oxalates. Okay, so everybody's talking about oxalates, right? So at one point, lectins were the dear thing for the food industry. Everybody wanted to have low lectin diets that is going to help this and help that and things. Right now, oxalates are another fad that we are all going through. Well, yes, oxalates are there. There are a lot of protective compounds and chemicals which are naturally present in a lot of different foods and things. Doesn't necessarily mean that it is harmful for each and every person. Okay, so some of the, if you check your oxalates levels and they are very high, then yes, it makes sense to lower oxalate foods, which are specifically high oxalate foods like spinach and some almonds and things. Okay, but if there is no reason, then the more food categories you remove, the more it will be difficult for you as a person to heal your body, because your body also needs different vitamins, minerals, antioxidants and things, and getting them with only one or two foods is not good. So the more restrictive a person's diet is, because everybody loves restricting diets and things, taking away food, and a lot of people that come to see me actually are eating only four or five foods. Dr. Gupta, I cannot eat lectins. I cannot eat, I was told I need to give up high histamine foods. I was told to give up oxalates, you know, and then I was told to give up fish and things because they are high in mercury, So what should I be eating? So I eat these five foods every day. I said, then obviously, as soon as we do the test results, everything is low for them. Their gut microbiome is very poor. So I said, obviously, your body, how is it going to get the proper nutrition? So everything has a place in there. So if you feel oxalates are your problem, you have checked them, they are high, then yes, avoid it. But no, I don't blanketly remove certain sections of food, because we don't have any research in human trials which says that okay, well, oxalate should be removed for thyroid patients or anything else also. Okay, so let's take other questions. Can boswellia be taken in essential oil form? Yeah, absolutely, not a problem. You can do essential oils of boswellia. That's fine too. Dennis has a question: is it true exercise increases mitochondrial biogenesis? Yes, exercise is wonder, right? It increases BDNF, it increases mitochondrial health, it increases serotonin, it increases dopamine, it reduces inflammation. So exercise does a whole bunch of things. So definitely, body movement is something that I encourage each and every person. They should include in their regular regimen. Now, again, things are good, but when we overdo things, then it can be bad. So that means people who already have high amounts of inflammation, vigorous exercising actually makes things worse. A research study was done on marathon runners. Before they started the marathon, they collected their blood. After they completed the marathon, couple of hours after completing the marathon, they collected their blood. The inflammation markers that I was sharing with you, HSCRP, was significantly higher after they completed the marathon. Okay, even few hours after completing the marathon. So, because marathons are again basically too much stress on the body. It's a physical stress which can increase our inflammation levels and things. Okay. So again, for a person who is very healthy, no problems and things, that inflammation is not bad because their body can control this inflammation, bring it back to normal. But person who's already inflamed, then that high intensity exercising, even marathons, might not be the best choice. So exercise is good. Too much inflammation is there, then start with doing low impact exercising, cardio exercising, and also weight training. But try not to go overboard with it. Okay, but yes, exercising is really really great. Okay. Is spinach good for thyroid? Is it okay to eat it raw? Yeah. Again, somebody will say spinach is high in oxalates. Okay. But as I said, if I have not seen oxalates being a problem for my patients, so that's the reason they eat spinach, or you can eat them raw. But if you want the best form of spinach, then you steam it very lightly. Okay. Because it activates quercetin into it, it activates the vitamin K into it, as well as iron into it. So it becomes more absorbable form. So, yes, spinach is perfectly fine, but if you want the best form of spinach, then only steam it very slightly so it wilts very slightly, okay, and that will activate all the good antioxidants and vitamins and minerals. Uh, how to check we have thyroid without doing any test? Well, if you have symptoms, if you have difficulty in losing weight or you're gaining weight, if you feel tired, you have brain fog issues, or if you have hair thinning or hair falling problems, or if you have depression, anxiety, these are all typical signs and symptoms that you have a thyroid disorder. So if you have any of these things, then you can have thyroid problems. So that is the case. Nightshades. Okay. Again, same thing. Yes, nightshades, a lot of people think that nightshades are a problem. Now, nightshades do have some research studies. Okay. But again, not each and every person of mine will remove nightshades. But let's say if I'm doing a diet and they're doing everything to to lower their antibodies, but if it's not doing, then we do an experiment of removing the nightshades from their diet for 4 to 6 weeks and repeating the antibodies. If we see a lowering of antibodies, then bingo, then we know that nightshades are their problem. But again, if we don't see their problem, then we have to look further. So that's where it's kind of all of these things, all of this information has to be used in a proper manner. Okay, we all have been thinking of having one particular food sections, which is bad. Like the food industry at one point said fat was bad and everybody was on a low fat diet. We saw instead of seeing the incidence of heart disease decreasing, we saw an incidence of heart disease increasing. So definitely that was not a strategy that was working. There is good fat and bad fat. So we need to reduce the bad fat and increase the good fat, right? So similar way, oxalates, nightshades, histamine, all those things have to be used in certain people and in certain way. So that's what was the case. Peanuts and sesame are good for hypothyroidism. So not the best choice, peanuts and sesame seeds or oils, because they're truly not nuts actually. So peanuts are actually have more properties which are very close, puts them very close to legumes. Okay, not actual nuts. So not the best nuts for my choice, or oils if you're using peanut oils, not the best choice. So typically I will say that maybe once, here and there you can eat them, but they're definitely not helping your thyroid. Okay. So Priyanka is sharing that, 1.5 years back, she watched one of my videos and she started taking turmeric and ghee, which is the Indian ghee, which is basically a good fat and bedtime. And that really helped her morphia. So that is a good thing. How long can you continue? Well, there is no harm in continuing it. It's pretty natural thing. Turmeric is not bad for our body, as we as Indians have been using it day in day out for almost every day of our life. So that's not a bad thing. Even ghee is fine. Obviously, make sure that you check your cholesterol levels. It doesn't go high. Typically, if it is a good quality ghee like A2 organic, then it will not raise your cholesterol. But again, it doesn't hurt to check your cholesterol at least once a year. But again, if it is helping you, there is no reason. Okay, if you want to stop it and see how that works, that is also fine to do. But in terms of it is harming your body, it should not. Okay, somebody has this question. I have high ASO titers and high IgE, high eosinophils, and I have joint pain in knees and lower and upper back. So when you have high IgE, high eosinophils, that is basically means your body is reacting to something in your environment. Either it can be something you're allergic to, or it can also be sometimes bad bacteria or parasite in your gut can also have you a eosinophil reaction. So first of all, make sure you're seeing an allergist, getting an allergy test done to check what foods or what things you might be allergic to, and then also working on your gut health, specifically working with a functional medicine provider to see if they can do a special stool analysis to check if you have parasites or bad bacteria in your gut. So that will be very, very useful. But that is the reason you have, but that can be the reason of your joint pains and things. Okay. So you saw our interview with Jonathan and Dr. Cynthia saying liver cleanse ensures metabolic organ dysfunction. So liver cleanses, right? Liver cleanses can backfire all the time. So you need to know again what you're doing, because there is a process of detoxifying your liver. There are 3 steps. If you have not seen my videos, you should know about those 3 phases of detox from the liver, and we need to work on all of those 3 phases. Then only people get better. So yes, I think liver detoxes are important. Everybody needs them, and all of our clients goes through liver detoxes. That is for sure important. Liver is very, very important organ which plays a very significant role in immunity, metabolic health and things. But you need to know how to do the liver detox. That's very important. Okay, let's see if we have any other questions over here. Is there a connection between thyroid and EBV? Absolutely. We have at least 4 or 5 research studies which shows that reactivation of Epstein-Barr virus leads to thyroid disorders. Okay, so there is no question about it. There is, but the question is what to do about it, because in conventional medicine there is no medicine for reactivation of Epstein-Barr virus. So that's where you will have to work on boosting your immunity, working on your immunity. Specific supplements and herbal things are there which can help with EBV also. But yes, there is blood test. Now if you go to regular doctor, they will do a monospot test. Okay, that checks for only if you have a new EBV infection. That is useless. We're talking about a detailed EBV testing which checks your IgM, IgG, viral nuclear antigen, all of those things, and then only you can know whether you have a reactivation or not. So very, very important to know. For autoimmune diseases, is rice and wheat harmful? Wheat, I will say gluten, we have good research studies that yes, it is harmful. Rice, not so much. Okay, so if you can eat brown rice or red rice, I think that is fine. But wheat, I will definitely give up and see how you do with that. So that's great. Wonderful, guys. I think we are coming to the end of our session. It was really, really nice that you guys were able to join in. And I think we had a good activity where you shared your pain points to me. So I will keep them in mind and hopefully try to gear some of the videos in that direction for you. We'll obviously keep doing these live sessions in the future also. Try to be kind of conscious about what people need. So maybe we'll do more videos on thyroid for next couple of weeks. So I can give you more information on thyroid, maybe, information on how you can lose weight, or maybe information on, improving your brain fog and energy also. Because those are the typical things that people with thyroid disorders suffer from. Maybe we can put up a poll. Okay, so I will put up a poll in the community section about the next topics that we should be that you guys want me to cover on, specifically related to thyroid, so that way we can I can cover that. So look at the community section. In the next few days we will be putting out a poll for you to kind of vote for your own sake of what next topic you want me to bring in for you, specifically to regarding your thyroid health, so I can do that. Thank you so much for joining us. It was really a pleasure. I always love, when you guys show up and show your love to our channel, to our videos. Hopefully these things are helping you and continue to help you. So keep sharing the good information, your love to us. Anything I can do to make things better, please, again, always your feedback is welcome. Again, thank you so much for showing all this love. We will see you again next week. Right. Thank you so much. Till the time, take care. Bye-bye.